You check your blood pressure and everything looks fine until you test the other arm and see a totally different number. Is it a fluke, a measurement error, or could it be a warning sign your heart and arteries are trying to send? In this video, we'll uncover why your blood pressure might be different in each arm, when it's normal, and when it could mean something serious. Stick around, because understanding this one detail could help you catch silent cardiovascular problems before they become dangerous. Let's get started with how blood pressure works and why it can vary between arms. To understand why blood pressure can differ between your left and right arms, you first need to understand how blood pressure works. Blood pressure is a measurement of the force your blood exerts against the walls of your arteries as your heart pumps. It's recorded using two numbers: systolic pressure, the top number, the pressure when your heart beats and pushes blood out; diastolic pressure, the bottom number, the pressure when your heart relaxes between beats. So, a reading of 120 over 80 millimeters of mercury means your systolic pressure is 120 and your diastolic is 80. But here's where it gets interesting. Your arms are not completely symmetrical, neither is the way blood flows through them. The arteries that supply blood to each arm branch off the aorta in slightly different ways. That difference in anatomy alone can cause slight variations in blood pressure. Let's break that down further. Understanding the pathway of blood flow. Your heart pumps oxygenated blood into the aorta, the largest artery in your body. From there, blood flows into the brachiocephalic artery, which branches into the right subclavian and right carotid arteries to supply the right arm and right side of the head. Blood also flows into the left subclavian artery, which directly supplies the left arm. This means the right arm's blood supply comes from a slightly different route compared to the left. That difference in vascular branching can naturally result in minor differences in blood pressure between the arms. Also, your dominant arm, the one you use more often, tends to have slightly more muscle mass and blood flow, which may influence pressure readings. In fact, studies have shown that in many people, the dominant arm may have a slightly higher reading. Other influences on readings. Beyond anatomy, many variables can affect blood pressure measurements. Cuff placement. If the cuff isn't wrapped correctly or is too loose, it's just tight, it can skew the results. Arm position. If your arm is too high or too low compared to heart level, the pressure may appear falsely high or low. Body posture and relaxation level. Sitting straight versus slouching, talking during the reading, or even being anxious can all influence the numbers. So if you measure both arms back to back and see a small difference, it could simply be due to positioning, the anatomy of your blood vessels, or even small measurement errors. But how much of a difference is normal? That's where things get serious and where many people unknowingly miss a red flag. We'll explore that next. Keep watching, because a larger than normal difference could mean your arteries are narrowing, possibly without any symptoms at all. Is it normal for blood pressure to differ between arms? So let's answer the big question. Is it normal for your blood pressure to be different in each arm? Yes, but only to a certain extent. A small difference in blood pressure between your left and right arms is actually very common. In fact, most healthy people will show a slight variation of up to 10 millimeters of mercury in either systolic or diastolic pressure. This is generally considered normal and not a cause for concern. But there's a threshold, and once you cross it, it could be a warning sign of an underlying health issue. What's considered a normal difference? According to guidelines from the American Heart Association and British NICE, National Institute for Health and Care Excellence, a difference of less than 10 millimeters of mercury in systolic pressure is normal. A difference between 10 and 15 millimeters of mercury may still be okay, but it warrants attention and monitoring. A difference of 15 millimeters of mercury or more in systolic pressure is considered abnormal and may signal narrowing or blockage of arteries on one side. These are often temporary or situational differences. However, if a significant difference appears consistently, it could be your body's early warning system. Why is it important to check both arms at least once? Most people only measure their blood pressure in one arm, the right arm, out of habit. But doctors often recommend that your first BP measurement be taken in both arms. Why? Because the arm with the higher reading may better reflect your true cardiovascular risk. Let's say your left arm consistently reads 118 over 78 and your right arm reads 132 over 85. If your doctor only measured the left arm, they might conclude your blood pressure is perfect, but the right arm suggests you're already entering the elevated or stage 1 hypertension zone. That's a big difference when it comes to prevention and treatment. Identifying the higher pressure arm early on allows for better risk management. A small difference? Probably nothing to worry about. A consistent gap of more than 10 to 15 millimeters of mercury? It's time to look deeper. Coming up next, we'll explore what serious medical conditions might be behind a large blood pressure difference between arms, and why this simple observation can help detect silent but dangerous diseases early. When to worry, what a large blood pressure difference can mean. Now that we know a small difference in blood pressure between your arms is usually harmless, let's talk about the other side of the coin, the times when it isn't normal. Because a large or consistent gap could be your body's quiet signal that something is wrong. Here's the key. If the systolic blood pressure difference between your arms is 15 millimeters of mercury or more, it may indicate underlying vascular disease or restricted blood flow to one arm or side of the body. If your doctor finds a consistent blood pressure difference, especially 15 millimeters of mercury or more, they may order an ankle brachial index (ABI) test to check for PAD. Use Doppler ultrasound or CT angiography to evaluate blood flow in the arms. Check cholesterol levels, blood sugar, and kidney function. Review your risk factors: age, smoking, diabetes, high blood pressure. A consistent difference in blood pressure between arms isn't just a number. It can be a silent sign of serious disease. Many of these conditions don't cause early symptoms, which is why noticing this difference and acting on it can be life-saving. Next, we'll go deeper into the specific medical conditions linked to unequal arm blood pressure and how your body might be trying to tell you something long before symptoms appear. Medical conditions linked to unequal blood pressure in arms. When your blood pressure readings are noticeably different between arms, it's not just a quirk of the body. It can be a signal of something deeper going on beneath the surface. These underlying conditions usually affect your blood vessels and circulation, which is why BP differences show up as an early clue. Let's break down some of the most common and most serious medical conditions associated with a significant blood pressure difference between arms. 1. Peripheral Artery Disease, PAD. As mentioned earlier, PAD is one of the most frequent causes of this issue. It occurs when plaque builds up inside your arteries, narrowing them and limiting the flow of blood. When one arm has a narrowed artery, particularly the subclavian or brachial artery, the pressure in that arm can read lower than the other. Who's at risk for PAD? People over 50, smokers, current or past, diabetics, people with high blood pressure or high cholesterol, those with a family history of cardiovascular disease. PAD can be asymptomatic in early stages, which makes detecting arm pressure differences a helpful screening tool. Over time, if left untreated, PAD can lead to pain while walking, claudication, poor wound healing, increased risk of heart attack and stroke. Second, subclavian artery stenosis. The subclavian arteries supply blood to your arms and part of your brain. If one of these arteries becomes narrowed, often due to atherosclerosis, blood flow is reduced, resulting in lower blood pressure in that arm. In more advanced cases, this can lead to a rare condition called subclavian steal syndrome, where blood destined for your brain is stolen to supply your arm during activity. Warning signs of subclavian stenosis or steal syndrome: dizziness or fainting, double vision, weakness or numbness in one arm, feeling lightheaded during exercise. Even if you don't have these symptoms yet, a consistent difference in arm BP could be the first red flag. 3. Aortic dissection. This is a rare but deadly condition where the inner wall of the aorta tears, creating a false channel for blood flow. It often results in a major BP difference between arms, severe tearing chest or upper back pain, shortness of breath or loss of consciousness. Aortic dissection requires emergency treatment, often surgery. The key to survival: early detection and unequal arm pressure might be your first clue. 4. Takayasu's arteritis. Takayasu's arteritis is an autoimmune condition that causes inflammation of large arteries, especially the aorta and its major branches. It's more common in young women under 40, particularly of Asian descent. This condition can lead to narrowing or blockage of arteries, reduced blood flow to limbs, uneven blood pressure, fatigue, joint pain, and fevers. It's rare, but when present, BP differences between arms can be a key diagnostic clue. 5. Coarctation of the aorta in younger adults. This congenital condition involves a narrowing of the aorta, usually just past the vessels that supply blood to the arms. It causes high blood pressure in the arms, lower blood pressure in the legs, headaches, chest pain, or fatigue in teens or young adults. Sometimes it may also cause unequal blood pressure between the two arms depending on the location of the narrowing. 6. Blood clots or embolism. Though less common, a blood clot in one of the arm's arteries can reduce blood flow and cause a sudden drop in pressure in that arm. This is usually associated with sudden arm pain, coldness or discoloration, numbness or weakness. This is an emergency that requires immediate medical attention. 7. Other contributing conditions. Diabetes damages blood vessels, increasing risk of artery narrowing. Chronic kidney disease leads to vascular stiffness and pressure imbalances. High cholesterol promotes plaque buildup. Smoking history, one of the top risk factors for atherosclerosis. Your body often sends subtle clues before serious symptoms appear. A difference in blood pressure between your arms might feel like a minor detail, but it can point towards serious cardiovascular issues, autoimmune diseases, or congenital problems. And the best part? You can detect this at home just by comparing BP readings in both arms. Next, we'll look at what the latest research says and what top heart experts recommend when they encounter uneven arm pressure in patients. What research and doctors say about arm blood pressure differences. So what do top researchers, cardiologists, and medical guidelines actually say about blood pressure differences between arms? The answer is clear. They take it seriously. While a minor difference is usually harmless, a larger and consistent gap between arm readings is now considered a predictor of cardiovascular risk, even in people with no symptoms. Let's explore what science says. Major studies and findings. British Medical Journal mmHg meta-analysis 2012. This study analyzed data from more than 20 studies involving over 20,000 people. It found that a difference of just 10 millimeters of mercury or more in systolic pressure between arms was associated with an increased risk of peripheral artery disease, PAD, linked to a higher likelihood of cerebrovascular disease like stroke, indicative of overall vascular damage. Key conclusion: measuring both arms could help detect silent cardiovascular disease earlier. Lancet Study 2019. This large-scale research involving over 50,000 patients showed that people with a systolic difference of 15 millimeters of mercury or more had a 70% higher risk of cardiovascular death, a 60% higher risk of dying from any cause. Even in patients who weren't diagnosed with hypertension, the BP difference between arms helped identify who was at higher long-term risk. American Heart Association AHA guidelines. The AHA advises that blood pressure should be measured in both arms at the first clinical visit, and the higher arm readings should be used for all future measurements. This helps to avoid underestimating a person's blood pressure and missing early-stage hypertension. NICE guidelines, UK. The National Institute for Health and Care Excellence in the UK also recommends measuring BP in both arms at the initial assessment, repeating the measurement if the difference is more than 15 millimeters of mercury, investigating further if the difference remains consistent. They also emphasize that a difference of 15 millimeters of mercury or more may indicate vascular disease and requires further testing. What do doctors actually do with this information? When doctors see a significant arm BP difference, they don't ignore it. Depending on the patient's age, symptoms, and health history, they may order ultrasound imaging of the arteries in the arms, Doppler studies, perform ABI testing to check blood flow in the legs, request CT or MR angiography to visualize blood vessels, refer to a cardiologist or vascular specialist. In some cases, early detection of arm blood pressure differences has led to life-saving interventions, especially for patients with peripheral artery disease, subclavian stenosis, or early signs of aortic disease. Many people, and even some healthcare providers, still focus on measuring blood pressure in only one arm out of habit or time constraints. Unfortunately, that can lead to underdiagnosis of hypertension, especially if the lower reading arm is used, missed warning signs of early vascular disease, inaccurate risk assessment. The growing body of research now shows that simply measuring both arms once could reveal crucial health information. Should you be concerned about your own BP difference? Here's a quick checklist to guide you. If the systolic blood pressure difference between your arms is between 0 and 9 millimeters of mercury, it's considered a normal variation, and no action is needed. If the difference is between 10 and 14 millimeters of mercury, it's recommended to monitor it closely and recheck your blood pressure in both arms within 1 to 2 weeks. If the difference is 15 millimeters of mercury or more, it could indicate a possible vascular issue, and you should see a doctor soon. If the difference is consistently above 15 millimeters of mercury, or if it continues to increase over time, it's important to discuss this with your healthcare provider. Doctors and researchers now view arm BP differences as an early detection tool, not just an oddity. A simple home check using both arms could alert you to serious vascular risks years before symptoms arise. In the next section, We'll walk through exactly how to measure your blood pressure correctly in both arms at home, so you can track it with confidence and possibly catch early signs of cardiovascular trouble before it starts. How to measure blood pressure in both arms correctly. If you've ever taken your blood pressure at home and gotten different numbers in each arm, you might have wondered, did I do something wrong? The truth is, even small mistakes in technique can lead to inaccurate readings or make a real problem seem like just a fluke. But don't worry, measuring your blood pressure correctly, especially in both arms, is easier than you think. Let's go step by step so you can get readings that truly reflect your health. What you'll need: a validated digital blood pressure monitor, upper arm cuff type is best. A notebook or app to record your readings. A calm, quiet place with a table or desk, a chair with good back support. Sit properly, take a deep breath, and check your blood pressure in both arms. Just note down everything. Wrist cuffs are not recommended for detecting subtle arm differences. They are more sensitive to movement and positioning errors. In the next section, we'll discuss what to do if your readings consistently show a difference, and what your doctor might recommend next based on your results. What to do if your blood pressure is higher in one arm. Let's say you followed all the steps, double-checked your technique, and still found that your blood pressure is consistently higher in one arm. What now? The good news is, you've already taken the most important first step. You've noticed it. Many people never do. Now it's time to understand what to do next, what your doctor may investigate, and how to manage it moving forward. Step 1. Use the arm with higher pressure. Once you've confirmed a consistent difference of more than 10 to 15 millimeters of mercury between arms, your first action should be, always use the arm with the higher reading for future measurements. This ensures you're not underestimating your blood pressure. Even a small underestimation can delay important treatment, especially if you're on the borderline of high blood pressure or pre-hypertension. Remember, your true blood pressure is higher. The lower reading doesn't reflect what's happening in your body system-wide. Step 2. Schedule a doctor visit. A consistent and significant difference in blood pressure should prompt a visit to your healthcare provider, especially if the difference is 15 millimeters of mercury or more. You have other risk factors like diabetes, smoking, or high cholesterol. You're over the age of 40. You experience symptoms like dizziness, numbness, fatigue, or arm pain. What will your doctor do? Step 3. Get further tests to identify the cause. Your doctor may recommend one or more of the following tests based on your readings and health history. Doppler ultrasound of the arms. This test uses sound waves to evaluate blood flow in the arteries of your arms. It can identify narrowing or blockages. Ankle brachial index, ABI test. Compare blood pressure in your arms and legs. Helps diagnose peripheral artery disease, PAD, which is a common cause of pressure differences. Computed tomography angiography or magnetic resonance angiography. Advanced imaging to visualize your aorta and major arteries. Helps detect conditions like subclavian artery stenosis, aortic dissection, or congenital abnormalities. Blood tests. To check for cholesterol levels, blood sugar, and kidney function, all of which affect your vascular health. Your doctor might also ask detailed questions about your family history of cardiovascular disease, smoking history, physical activity, symptoms, even minor ones. Step 4. Treatment depends on the underlying cause. Here's what may happen based on what the tests show. If the cause is peripheral artery disease, PAD, you may be prescribed antiplatelet medications, like aspirin, or statins to lower cholesterol. Lifestyle changes are critical. Quitting smoking, exercising, and eating a heart-healthy diet. If it's subclavian artery stenosis, mild cases may be monitored and managed with lifestyle and medication. Severe cases may require angioplasty, a procedure to open the narrowed artery, or surgical bypass. If it's aortic dissection or another emergency condition, immediate hospitalization and possibly surgery are needed. These conditions are rare but life-threatening, and BP differences are sometimes the only early clue. If no serious disease is found, you'll likely be advised to continue monitoring your blood pressure, maintain a healthy lifestyle, and use the higher pressure arm for all future readings. Step 5. Track your numbers and be proactive. Even if your doctor finds no dangerous condition, it's still important to monitor your blood pressure over time. Here's a simple tracking approach. Record your BP twice daily, morning and evening. Use the same arm each time. preferably the higher pressure arm. Track trends, not just single readings. Bring your log to every doctor visit. Consistency is key. Over time, you and your doctor can watch for any changes that may suggest something is developing. A blood pressure difference between arms is not a diagnosis, it's a clue. Sometimes it's harmless, other times it's a silent signal that something isn't right. By noticing it early and acting quickly, you're giving yourself the best chance to protect your heart and arteries before symptoms ever appear. The difference in blood pressure between your arms might feel like a small thing, but for many it's the first signal of something bigger. And the best part? You can detect it yourself, at home, in minutes. That's the power of awareness. That's the power of prevention. If you found this video helpful, give it a like and share it with someone who checks their blood pressure at home. And don't forget to subscribe, because on this channel, we uncover the silent signals of your body and teach you how to protect your health one step at a time. Stay informed, stay healthy, and always keep both arms in the picture.